not able to answer your questions, or if we run out of time, or if I don't know the answer, this doesn't have to be, the end of the line. We have a hotline that we provide services to Medicare beneficiaries in LA County. I'll share the phone number again at the end of the presentation, but please feel free to reach out with any questions that might come up after the presentation, or if you're approaching Medicare eligibility and have questions down the road, or questions about how your benefits work together. We can certainly try to help. You don't have to just request to speak with me. We have a number of counselors available who are all registered with Medicare. So we are registered Medicare counselors, and our services are primarily funded by the California Department of Aging. You may have heard of us referred to as the HICAP program. That stands for Health Insurance Counseling and Advocacy Program. So we also have a website. We have some great resources available on our website, some of which are very relevant to the topics we're going to be talking about today. So with that, I will go ahead and get started. So today's presentation, I'm going to go over a few different things. So I'm going to start out giving sort of an overview of Medicare. Some of this might be new to you, some of it you might already be very familiar with, but I really like to make sure that we're all on the same page when it comes to the basics of Medicare eligibility, benefits, costs, since those costs, it isn't free, and the costs do go up every year. And then we'll talk about the different ways to supplement Medicare, because it doesn't cover everything and it doesn't cover all of the costs. And then we'll talk a bit about Medi-Cal, a couple of Medi-Cal programs that might be relevant or useful for you, and also how Medicare and Medi-Cal work together. So that's sort of our roadmap. So first, what is Medicare? Again, you might already know this, but because Medicare and Medi-Cal have such similar names, I always like to make sure that this is clear at the beginning. So Medicare is a federal health insurance program. It provides health benefits to people who are either age 65 and older, or people under 65 who are basically on SSDI or have another disability. Eligibility for Medicare is not based on your income or your resources or assets. So regardless, you could make $1 million a year, you could make, $100 a year, and it wouldn't impact whether or not you're eligible for Medicare, because the eligibility is based on other things. So again, different eligibility rules for Medicare versus Medi-Cal. So when we're thinking about Medicare, it's typically seniors, people over age 65, or people on disability benefits from, SSDI. So I know in the cancer context, a lot of folks do frequently apply for SSDI benefits. We'll talk a little bit about, when you would become eligible for Medicare based on SSDI. Now, the flip side, Medi-Cal is a state program. So every state has its own Medicaid program. In California, we're special, we call it Medi-Cal. And eligibility for Medi-Cal is based on income limits. And then folks who are 65 or older or on disability would also have to meet certain asset limits. So you might not be able to have $1 million in retirement savings and qualify for Medi-Cal, but that gets a little tricky. So we'll talk more about that as later in the presentation. Okay, I know I'm like really driving this point home, but we do get a lot of questions from people who say, hey, I'm in my 50s, I was just diagnosed with a serious illness, or I'm thinking about retiring early. How do I sign up for Medicare? Well, unfortunately, you really do have to meet these strict eligibility criteria. So it's either for people who are 65 or older, who have paid into the Social Security system and have a certain number of work credits with Social Security, so eligible for retirement benefits. Even if you're not eligible for full retirement benefits at age 65, because I know some folks are eligible for full benefits at age 66 or 67. Regardless of that, you would become eligible for Medicare at age 65. So even before you might be collecting retirement benefits. Or you can qualify on a spouse's Social Security record, or sometimes a former spouse. Excuse me. And then for people under age 65, the only way to qualify for Medicare is if you have been receiving Social Security Disability Insurance, SSDI, for at least 24 months. So there is that 2-year, basically, waiting period before you would become eligible for Medicare. You have some other, there are 2 other types of disabilities that might qualify somebody for Medicare sooner than that. And that's ALS, also known as Lou Gehrig's disease, or end-stage renal disease, but we're not going to go into those today. So in terms of enrolling in Medicare, it's really important to pay attention to when you might be eligible to enroll. So for most people, it makes sense to enroll in Medicare during their what's called initial enrollment period. So the initial enrollment period is a 7-month period, basically surrounding the person's 65th birthday, or a 7-month period surrounding that 24th or 25th month of SSDI enrollment. So it begins 3 months before the month you become eligible for Medicare, includes the month you become eligible. So for a lot of people, that's their 65th birthday month, and then 3 months after. Now, if you miss that initial enrollment period, that doesn't necessarily mean you're out of luck altogether. Every year, there is what's called the general enrollment period, where you can enroll in parts A and B from January through the end of March each year, and those benefits start July 1st. So if you miss your initial enrollment period, there is a risk, and I'll talk about late enrollment penalties because that's another thing to be concerned about. But even beyond the late enrollment penalties, you can see that if you miss your initial enrollment period, it's possible you could have a pretty big gap in your health coverage. So if you enroll in, the general enrollment period, if you enrolled, this year in the general enrollment period, your benefits don't start till July 1st. You could run into some issues with, not being covered in the meantime. Now, some other folks might be eligible for what's called a special enrollment period. That's where certain circumstances or life events might qualify you to enroll later without having to worry about penalties or gaps in coverage. So one major example of a special enrollment period is for people who have employer-sponsored health coverage. A lot of times people will delay their Part B enrollment. And then once their employer coverage ends, they have an 8-month special enrollment period where they can get into Medicare without having to worry about late enrollment penalties. So I'll talk about those penalties in a minute. So one big question we get asked a lot, how does Medicare work if I already have employer coverage? So I mentioned that some people will delay Medicare coverage if they have employer-sponsored coverage. Typically, if someone is covered by an employer health plan from current work and then is eligible to enroll in Medicare, the employer plan will be primary and Medicare will be secondary. So for some people, they don't want to pay for Medicare if it's only going to, basically cover maybe copays, or, if the employer plan is really good and provides really good coverage, they might not really need a secondary plan. So that's why some people will delay. But whether the plan is primary or secondary does sometimes depend on the size of the employer. So if this is something you're not really sure about, feel free to give us a call and we can sort of talk you through, you know, how you would be eligible or how your benefits would work together depending on the size of your employer. And if somebody has Medicare and a retiree plan from a former employer, Medicare is typically primary, and then the retiree plan helps cover copays and deductibles and that type of thing. Okay, so what does Medicare actually cover? And what are all these different parts? It's like alphabet soup, trying to figure out, you know, does Part B cover this, Part D? So Part A is for hospital coverage. So if you are admitted to the hospital and stay overnight, that is typically covered by Part A, which is a little different than if you go into the emergency room and you're just there for a few hours or even maybe there overnight just on observation. That's going to be something that's probably covered under Part B. So Part A is hospital services, home health care, which is somewhat limited, but it does provide some coverage for home health care if you need, you know, certain skilled nursing at home, skilled nursing care in a skilled nursing facility, also, you know, sometimes referred to as a rehab facility or a SNF, hospice care. Those are all Part A. Part B is typically your outpatient visits. So doctor services, labs, x-rays, if you need durable medical equipment like a wheelchair or a walker, those things are covered under Part B. I'll talk a little bit more about preventive care, mental health services, also covered under Part B. Now, Part D, I will go into a lot more detail a little later in the presentation, but that one is for prescription drugs. And there are some drugs that are covered under Part B. So if it's something that you're having injected at the doctor's office or needs to be administered at the doctor's office, typically that's a Part B medication. Part D is the stuff that you get filled at the pharmacy. Okay, so preventive benefits, I mentioned, are covered under Part B. You know, Medicare has made some changes under the Affordable Care Act to make sure that more preventive services are available without having to pay a copay or meet your deductible. So free annual mammograms for women age 40 and over. Although if you have already been diagnosed with breast cancer, this would not be considered preventive. Most likely it would be, you know, a follow-up diagnostic. That's how it would be billed. You know, free pap smears and pelvic exams every 2 years, colorectal cancer screenings for people age 50 or older. So those are some of the cancer screenings that are, you know, should be available without having to pay a copay or meet a deductible. There's also a free annual wellness visit to complete a comprehensive health assessment. It's a little bit less comprehensive than like a typical full physical, but it is, you know, worthwhile and it's available for free. Free flu shots, and then obviously the COVID-19 vaccine is also covered under Medicare. Now I want to talk a little bit about the various costs associated with Medicare because, you know, I think a lot of people are surprised when they learn how much they have to end up spending out of pocket for their Medicare coverage. So first, for Part A, if you are receiving SSDI, that means that you have been paying into Social Security. You get Part A for free. There's no monthly premium. Same thing if you have paid into Social Security and have at least 40 work credits with Social Security. You know, when you turn 65, you would get Part A for free. You do have to call Social Security or, you know, submit an application. If you're already receiving retirement benefits when you turn 65, you'll automatically get enrolled into Part A. Again, no monthly premium. If you have fewer than 40 work credits with Social Security, you would potentially have to pay for Part A coverage. And so, it depends on the number of work credits you have with Social Security, how much you would pay. There is also something called a Medicare Savings Program. If you have really low income and minimal assets, you could potentially qualify to have the state cover that monthly premium. But you're not required to enroll in Part A if you have to pay for it. You might be better served by other coverage. So if you have Part A, again, there are copays that you might owe. So if you're admitted to the hospital, there is typically a first day deductible. So it's not something you're paying every day when you're in the hospital. Let's say you get admitted and you're there for a week. You would only pay this first day deductible once. And then even if so this would cover days 1 through 60. So if you went back home, got released and then ended up back in the hospital again within those first 60 days, you might not have to pay that again. But if you're in the hospital for a long time, those copays do potentially add up. Skilled nursing facility. So a lot of folks, let's say they go in for surgery, they're in the hospital for a few days, and then they get released to skilled nursing. Days 1 through 20 are covered in full under Part A, but if you're in the skilled nursing facility for longer than 20 days, then you would potentially start facing copays as well. Now for Part B, there is a standard monthly premium. It goes up every year, and in 2021, that monthly premium is $148.50. So most people pay that standard premium. If you are a higher income earner, so for a single person, if you earn, more than $88,000 a year, or if you file jointly as a married couple and your combined income is over $176,000 a year, you're going to pay more than that. It's something called an IRMA, or income related monthly adjustment amount. And it varies depending on how high your income is. So if your income is higher than this, don't be surprised if you get something in the mail when you sign up for Medicare saying, oh, you owe this $148.50 plus this additional amount. And there's ways to, potentially appeal that or request that they look at a different year in terms of your taxes. They usually look at your tax return from 2 years prior. So if you've had a major life change or a major income change or work reduction, maybe you've retired, that's something that you can share to try to, appeal that IRMA. Now I mentioned that there are late enrollment penalties if you don't sign up, on time for Part B. The Part B late enrollment penalty is pretty significant. So for every full 12-month period that you could have been covered by Part B but were not, it adds another 10% for life to your Part B premium. So, going back here, let's say the standard premium is $148.50. Let's say for whatever reason you delayed your Part B enrollment, you missed your initial enrollment period and one full 12-month period went by. That means that you might have another approximately $15 a month added to your monthly premium for life. So that adds up pretty quickly. So it's a good idea to really double check things before you decide to delay your Part B. Now, Part B also has co-payments and a deductible. In 2021, the deductible is $203. And then most people pay, so you might have heard of Medicare covering 80%, and then the beneficiary or the patient is responsible for 20%. So that's typically the copay. So if you go into the doctor's office and it's $100, medical visit, Medicare might pay $80 and you might have to pay a $20 copay. The one way to avoid having additional charges like this, excess charges, is to look for Medicare providers who accept what's called assignment. So if you go see a doctor who has not, who contracts with Medicare but hasn't agreed to accept what Medicare pays as payment in full, they can charge up to additionally, I think, another 15%, and then the patient is responsible for that. We don't hear a lot about excess charges, so that's just something to keep in mind, but I don't think it comes up that frequently, as long as and you can look on the Medicare website for doctors that specifically do accept assignment. So that just means that they've decided to accept whatever Medicare charges or whatever Medicare reimburses as payment in full. Okay, so finally, Part D. Do I have to enroll in a Part D plan? Well, maybe. So if you have drug coverage that is equal to or better than the standard Medicare Part D benefit, you don't have to enroll in a Medicare drug plan. So an example of that might be if you have employer coverage or potentially retiree coverage, they will tell you, they're required to tell you, and if you don't know, you can always call and ask. And the magic words are, is this drug coverage creditable? Is this creditable drug coverage for Medicare? If they say yes, then great, you've already got your prescription drug coverage. You don't have to worry about Part D. Another example of that is if you have VA drug coverage. The VA is very good about prescription drug coverage. If you have VA drug coverage, you don't need Part D. If, however, you don't have other drug coverage and you don't enroll in Part D and then you enroll later, you miss that enrollment period, you may face a penalty. The penalty is quite a bit more manageable than the Part B penalty. So, again, if you're not sure, do I need Part D coverage? When should I enroll? Please feel free to give us a call. So some people may have heard of Medicare Part C. I do not like to use that term because I think that implies that it's a mandatory part of Medicare, and it is not. What is typically referred to as Medicare Part C is this option here on the right, a Medicare Advantage plan. So when you're getting Part D coverage, you have two options. You can go this route on the left, where you have original Medicare. So your Part A and B, you're not locked into any plan. You can go see any doctor that accepts Medicare. You don't have to worry about getting prior authorizations or referrals to specialists. It really gives you a lot of flexibility. And then you enroll in a separate Part D plan. The other option is, if you like an HMO, so a managed care plan where you are locked into a plan network, you have a primary care doctor who does all your referrals to specialists, your prescription drug coverage is included. That is one option. So that's what's typically referred to as Part C. I don't like using that term. It's Medicare Advantage. And in LA County, they are all HMOs, which means you really can't go out of network to see other doctors. There's one PPO. It does have a monthly premium that gets added on top of the Part B premium. So if you have questions about that, certainly we can talk about that more. But basically, two main options for getting Part D coverage. So when can someone enroll in a drug plan? Same idea as with Parts A and B. You have that initial enrollment period when you first become eligible for Medicare. First, you have to, start that initial enrollment process with Social Security for Parts A and B. And then once you know that Parts A and B are going to be starting on a certain day or certain month, then you can look into Part D. And then every year in the fall, that's probably when you start getting lots of things in the mail. You see all of the advertisements on TV, join our health plan, we have all these extra benefits. That's the annual election period from October 15th to December 7th. If you make a change to your coverage during that time, benefits become effective January 1st. And that's when you can either choose a new Part D plan or a new Medicare Advantage plan, or enroll in Part D coverage for the first time. So Part D also has a special or various special enrollment periods. So, if you lose your employer drug coverage, you get a special enrollment period to get into a new plan. Typically, the special enrollment period for Part D, when it's a big life event that's changed, you typically have 63 days to select a new plan. So let's say you were living in Arizona and you moved to California and your Part D plan in Arizona doesn't cover you here, you would have a special enrollment period to get a new plan. Also, if you enter or leave a nursing home, that's something else that will trigger a special enrollment period for drug coverage. Now, one of the things you may have heard of with Part D is this idea of the various coverage periods and the donut hole. I'm not going to go into detail about that today, but just so you're aware, there is a $445 annual drug deductible, although that does vary depending on which plan you enroll in. Some plans have chosen, like some Medicare Advantage plans, for example, have chosen to just get rid of the drug plan deductible. So you might have a $0 deductible or might be lower. But typically, during the initial coverage period, until your drugs reach a certain amount of money out of pocket, you pay 25% of the total retail cost. And then, beyond that, there are these other coverage periods, but I won't bore you with that today unless anyone has specific questions at the end of the presentation. Now, if you're having difficulty affording your prescription drug costs, you're not alone. But there is a program that can provide some assistance if you qualify based on your income and your savings. So this program is through Social Security. It's called Extra Help, also referred to as the Low Income Subsidy Program, or LIS. So you might see on the next couple of slides something that mentions LIS. It's the same thing as Extra Help. And that's something that our agency can help you apply for. And there's also a really easy, straightforward application on the Social Security website. So in order to be eligible for Extra Help, there are a couple levels of assistance available. So to even get just a little bit of assistance, you still have to have pretty low income. So the income limits in 2021 are about $1,600 a month for an individual, about a little under $2,200 a month if you're a married couple. So your income would, and then there are obviously also asset limits. So your income would have to be rather low in order to qualify, but the benefits are really great. Your deductible is potentially $0 or $92. You pay a set amount for your co-pays for your drugs as opposed to a percentage. So, if anyone has questions about the Extra Help program, we can certainly talk about that as well. I want to make sure I'm able to leave time for questions, and I still have a bunch more slides, so I'm going to move a little bit fast here. So, we talked now about the various parts of Medicare, what they cover, enrollment periods, the costs. Obviously, there are gaps, right? Medicare doesn't cover everything, and it doesn't cover everything for free. So some of those gaps, we talked about the costs, monthly premiums you might have to pay, co-pays, deductibles, same thing under Part D. There are certain major benefits that are not covered by Medicare. And I think that can kind of be a surprise sometimes. So dental care, not covered. Podiatry, eyeglasses, hearing aids, incontinence supplies, transportation and medical services, and then a big one, in-home care, that's like custodial care. So that or at a nursing home. Those things are typically not covered by Medicare. So this is not, oh, I need a nurse to come help deal with my, I don't know, wound care, that might be skilled care, that Medicare may cover depending on your situation. But custodial care is more like, oh, I need help with preparing meals or doing laundry, assistance around the home, taking you to doctor's appointments. Medicare does not cover that. So personal care services at home is a really, really big gap. Now, Medi-Cal does cover those things. So, when we're talking about Medicare and all these costs and all these gaps, there are a couple of ways to supplement the coverage that you have. So I know this slide is really overwhelming, but the first on the left-hand side, that's that same original Medicare, also referred to as straight Medicare. People also talk about it as fee-for-service Medicare, whatever you want to call it. That's where you're not locked into a plan network. You've got those, Part A and B, and then a separate drug plan. And then you might, usually if you go this route, you will have some other type of secondary coverage. So for some people, I should probably have a third box here that says, employer coverage or retiree coverage. But a lot of folks will have either retiree or employer coverage. They'll purchase a Medicare supplement plan, also known as a Medigap. Those are private insurance plans. They're not considered health insurance because all they do is once Medicare pays, they pay their share. They're not making coverage decisions. Oh, was this medically necessary? Oh, they went to a doctor out of network. That's not what they do. These plans are literally just there to help pay those copays and deductibles. The other option for supplementing your care when you have this, this form of Medicare is Medi-Cal. If you have low income, and we'll talk about various Medi-Cal programs, but that's one way to have all of your copays and deductibles and actually also get these additional benefits is through Medi-Cal. Now, the other option is to have a Medicare Advantage plan. Some of them do cover dental and vision services. They might cover hearing aids or podiatry. So they have the flexibility to actually add some additional benefits. One thing to keep in mind about Medicare Advantage plans, I know I mentioned that the plan networks can be limited and you might have to jump through some hoops to get referrals to specialists. But if money is an issue and you don't qualify for Medi-Cal because your income's not quite low enough, or maybe you have savings or something, a Medicare Advantage plan can be a good way to save on your out-of-pocket costs, because instead of that 20% copay, they typically have set amounts for copays for doctor visits or hospital stay, that type of thing. A lot of the HMOs don't have an additional monthly premium, so you might just pay your Part B, as in boy, premium, and you'll get your prescription drug coverage and have more limited out-of-pocket costs. So, this is a good option if you're concerned about your out-of-pocket costs, but maybe can't qualify for Medi-Cal. So going back to, this model where you have original Medicare, and let's say you want to look into, you like the idea of having the flexibility to see all sorts of different doctors, and you want to look into a Medigap. So again, these are private insurance policies that cover some or all of the copays and deductibles from original Medicare. They are all standardized. And of course, it's more alphabet soup here. So there's all, these different letters that are associated with these different plans. But the good thing is, if you get a plan F at, Blue Shield, it should cover the same thing as a plan F at, United Healthcare. So they are standardized. And some of them have a foreign travel benefit. Medicare doesn't typically cover you outside the country. So if you travel a lot, that could be something to look into. And they're regulated by the Department of Insurance at the state level. So, you can get rate surveys and get more information about the various Medigap plans available on the CDI website. And it's also important to keep in mind that they can be very expensive. Okay, so moving on to Medi-Cal. If you get SSI, so supplemental security income, not SSDI, you automatically qualify for Medi-Cal. But a lot of the folks that we talk to, because we talk mostly to seniors and people with disabilities, the Medi-Cal aged and disabled, AD, FPL, federal poverty level program, is the one that folks are, mostly looking to qualify for. So again, very limited income limits, very low resources. So if your income is over this amount and you're trying to qualify for Medi-Cal, but you have, resources under this amount, you might get approved with something called a share of cost, where you might have to basically meet like a monthly deductible before Medi-Cal will kick in. But these income limits actually just went up substantially in December. It was quite a bit lower last year. So it's still very low, but this is a huge improvement from where we were last year at this time. Now, one program through Medi-Cal that I always like to talk about because I don't think it gets enough recognition, this is something that has helped a lot of our clients whose income is over, they're disabled, right? So maybe they're on SSDI, but maybe they get Social Security disability insurance income, SSDI income that's way over this. So how can they qualify? Well, there is something called the 250% Working Disabled Program. And I know that SSDI has very strict work limits. You can't earn more than a certain amount each month or each year, in order to maintain your benefits, the substantial gainful activity. This is completely separate from that. So if you're trying to qualify for Medi-Cal and you get SSDI, or you had SSDI that then converted into retirement benefits when you reached full retirement age, Medi-Cal actually won't count your disability income towards these income limits. So that means that you could be earning some money, or maybe you live in a household where your spouse is earning some money, and you're on SSDI or potentially workers' compensation or state disability. They won't even count. So let's say you get $1,500 a month from SSDI, that does not count here towards this income limit. So that really frees people up to, potentially qualify for Medi-Cal at higher income levels, as long as they meet these eligibility requirements. So they have to be disabled or have been deemed disabled by the state or federal government. You do have to have low assets, but if you have retirement funds in an IRA or 401k, that won't count, so they won't look at that. And then you do have to be earning money. And sorry if you can hear the garbage truck in the background, the joys of working from home. So you do have to be earning some money by working at least 1 hour per month. Now, this is really flexible. This is not saying, oh, you need to go back to your old job, or you need to be working in an office or in retail, or, getting a W-2. Like, it doesn't have to be formal work. You can have a friend or family member or neighbor write an employer verification letter letting, the state know, oh, Stephanie is babysitting my kids twice a week and I pay her, for 3 hours and I pay her $10 an hour. I have had folks who are even bedbound, who cannot get up and go do anything outside of their bed, but they will help sort mail for the family, or they will fold clothes for someone else in the family, water the neighbor's plants, walk the dog, take the trash out. I mean, any little task that somebody can pay you for is something that might qualify for this program. So I really want to make that clear. And, typically people are paid in cash for these types of things. So it's not something that should affect, your SSDI benefits. Now, if you have both Medicare and Medi-Cal, you are typically required to have your Medi-Cal as part of a managed care plan. So there are a few different Medi-Cal plans in LA County. The biggest two are HealthNet and LA Care, and then there are some partner plans. Oops. Now, if you have Medicare and Medi-Cal, Medicare is the primary insurance and Medi-Cal is secondary. So even if you have your Medi-Cal is one of these plans, you don't have to go to providers that accept these specific plans if Medicare is your primary insurance. So it doesn't matter. You don't have, if Medicare is primary, you don't need to call up LA Care and say, hey, I need a primary care doctor. That shouldn't make a difference. It's really just, does the doctor accept Medicare with Medi-Cal as secondary? Now, if you have full Medi-Cal, so you qualify, at your income limit, you don't have a share of costs that you have to meet every month, Medi-Cal will pay the Part B premium for you. So that's a big savings. And then you can't be billed for any Part A or B co-payments or deductibles. So that's another huge savings. So what typically happens is you go to the doctor, Medicare pays first. Once Medicare pays, they send the rest of the bill to Medi-Cal, and then Medi-Cal pays their share. Sometimes doctors will say, look, I don't want to deal with Medi-Cal, but I'll just waive those copays. That's one option. Unfortunately, there is another option where doctors can say, look, I don't want to deal with somebody who has Medi-Cal as secondary coverage. I'm not going to see you. But that is unfortunately something that they are allowed to do. So keep that in mind. But they really are not allowed to bill you for copays or deductibles. That's something called balance billing, and that's something that our agency can also help with. So if you have Medicare with Medi-Cal as your secondary coverage, you do have to get a prescription drug plan. But if you don't select one, you will get automatically enrolled into a Part D plan with a $0 monthly premium. So if you have Medi-Cal, you automatically qualify for that extra help program that I mentioned, and your copays are actually even less than the folks that qualify, at higher income limits. So you only pay in 2021, it's $1.30 for a 30-day supply of generic drugs, $4 for a 30-day supply of brand name drugs. And then you also actually get additional opportunities, because I think they recognize that if you have Medicare and Medi-Cal, it's possible you might have a very complex medical situation and might need more flexibility to change your prescription coverage. So you actually would get a special enrollment period to change coverage every quarter of the year. So that's another, and that's true even if you don't have Medi-Cal. If you qualify for extra help separately, you do also get these additional special enrollment periods. Now, one last thing I wanted to mention, I always want to raise this because it is an issue. Medicare fraud is surprisingly frequent, or maybe not surprisingly, it's very frequent. People try to take advantage of seniors. Certainly it's, they try to bill the federal government for all they can. So just be aware of telemarketers, door-to-door solicitors that are asking you for personal information about your Medicare. Don't give away your, Medicare number or your Social Security number. Make sure that you're checking your medical statements or your Medicare summary notices to make sure that, if there are services on there that you didn't receive, maybe somebody was trying to use your number. And do not respond to free offers for medical equipment or services. Sometimes we hear from people who, they receive a knee brace that they never ordered, and it's been billed to Medicare. And then once they actually need something, then it's like, well, you already received this. Well, they didn't need it at the time and they never asked for it. I don't know how these, I mean, scammers are getting more and more sophisticated. But, you know, with COVID-19, those scams have increased, you know, offers for COVID testing kits or at home testing. I mean, just be aware. And the last thing that's not mentioned really on here, but be very careful working with brokers or agents who are trying to sell you various Medicare plans or policies. Our agency, we don't sell anything. We don't get commissions. We're a nonprofit agency, and we provide unbiased, free information and counseling. So, you know, if you're talking to a broker who says, oh, well, I can get you better benefits by enrolling you into this plan, or I can get you this by enrolling you into that plan. And if you want to just double check, please feel free to give us a call and we can let you know, like, well, no, you are going to have a monthly premium for that. Or, well, no, it doesn't sound like your doctor is going to be included in that plan. We hear of a lot of marketing misrepresentation that might not totally amount to fraud, but it is a problem. And we end up, you know, trying to resolve the issues that some folks get in when a broker or an agent, you know, enrolls them in a plan and makes false promises. So it's obviously better to avoid that if at all possible. So especially during the open enrollment period in the fall, that's a really good time to talk to us if you're concerned about, or, you know, want to know, hey, is there a better plan out there for me? You know, we can certainly help do some of that research and see what plans are available, and you don't have to worry about us trying to sell you anything. So I promised I was going to leave a couple minutes for questions. I've got 6 minutes, so I made it under the wire here. But like I said, you know, I'm happy to try to answer some questions now, but if you have questions that come up, please don't hesitate to give us a call. We will schedule you for an appointment to speak with a counselor. The wait time is not very long these days. I think, you know, we're scheduling usually like next day appointments. And yeah,